What's your biggest headache right now? Let's get an update on Cannon theory. What's the headache this Monday morning?
Well, it's that the exchanges keep collapsing or slowly collapsing
Aetna's
across the
out,
state.
Anthem, et cetera.
So you've got 43,000 people in East Tennessee who have no exchange plan options after December. It looks like the same thing could happen across the state of Iowa, in other states, Georgia, and so forth. Oklahoma has only one carrier left in the exchange. If that carrier leaves, then you've got a lot of Oklahomans who have expensive medical conditions, but no way to get affordable health insurance. You tore to shreds equal opportunity Obamacare, and you tore to shreds Trump care. What you want is hugely controversial. I don't even want to go into it right now. What do moderate, well-thinking senators, Democrat and Republican, what do they do right now, given what you just outlined? And critically, as they rebuild health care, what are they going to do with it? Well, that's not the only thing that's happening in the exchanges. The coverage for the sick is getting worse, and the only way to solve that problem, to stabilize the insurance markets, to stop the race to the bottom in coverage for the sick. What are the senators going to do? Is to get rid of the regulations, and they're debating that right now. Now, how do you cobble together 50 votes so they could do that is the big question. No one really knows. Okay, but this is critical, Michael. They're not going to do Cato 101. I get that. Right. What are they going to do to straddle two failed systems, in your opinion? Well, I don't think it's two failed systems. I think it's the same failed system because Trump care, or the House bill, keeps in place the very provisions of Obamacare that are causing the markets to collapse. And so I don't know. I can't make them do the Cato plan, but unless they do something that gets rid of the very regulations that are causing these problems, we're going to keep seeing this sort of collapse. Over every cocktail in England, not that I had a few cocktails, Carl, over every cocktail, we talked about NHS and a more socialized medicine, which is anathema to you. What's wrong with the British system? What's wrong with the British system is you don't get the sort of innovations that bring healthcare within the reach of more people. You get all sorts of quality problems, the waits for care there, the rationing for care there, and you don't get the sort of innovation. You get the sort of new treatments that actually make that cure previously untreatable diseases. The United States leads the world in those things. Well, we lead the world in perspective. Francine, what does he say in reality? Is your reality you got to wait in lines and your kids get lousy care?
Yeah, so Michael, I take your point that it is, innovation maybe that gets stifled, but it's free for all. It's access to all here, NHS in the UK, like in many European countries.
Well, it's certainly not free. I mean, there are all sorts of harms that are done by the excessive taxes that Britons have to pay in order to pay for this system. It is you don't spend as much on the British National Health Service as we spend on healthcare in the United States, but you do end up with a whole set of perverse incentives and problems in that system that actually we do see in the United States in our version of the British National Health Service, which is the Veterans Health Administration. And so I like to say here in the United States we have every type of socialized medicine that you find anywhere else in the world, but we've got it all in one place here, and so we get the sort of rationing and waits for care in our version of the National Health Service that you get in yours.
Yeah, Michael, actually, I want to move away from the subject just briefly. Is your system in the US better at coping with cyber attacks? This is really the story, over the last 3 days here, as NHS was hit by cyber attacks. What about the US?
Well, I think that is one advantage that a more diversified market-based system has, is that you have multiple health systems. You're going to have multiple approaches to dealing with these sorts of cyber attacks instead of one nationalized system where if those who are trying to bring it down can figure out just one way to take down, if it's one system, they only have to figure out one way to take it down, whereas if you have a more diversified system, they have to find multiple ways, and you have those systems competing on that dimension of quality. How do you protect your private medical information? How do you protect the system from that sort of attack? Dr. Weinberg, a question for Michael Cannon.
Michael, so it's a mess, it's falling apart, there are problems. What's the least bad thing that we can do that has to be done, that can be done in the next few months in order to fix it?
Well, I think that the least bad thing is to do exactly what President Trump promised he was going to do, which was, and was elected to do, which is full repeal, which means you get rid of all the regulations, you get rid of all of the spending, you get rid of all of the taxes in the law. And then you replace it with health savings accounts. You expand these sort of tax-free accounts so that people can take the money their employers are spending on their behalf. It's their earnings. They should get to control it. They will make much better decisions with that money. They will drive down prices, and they they'll be able to purchase insurance that's more secure, stays with them from job to job, so we're reducing the problem of pre-existing
Can you
conditions.
do that between now and December?
I think it can be done between now and December. Whether it will or not, that's the big question. I think things may have to get worse before they get better.
You have a provocative half a sentence in your research note. If Hillary Clinton was president, would we be having the same conversation right now with President Clinton?
I think it would be a different conversation. I think Republicans would still be united in opposition to Obamacare instead of passing bills that would preserve much of it and give it a Republican imprimatur.